we're going to talk about coronavirus. It's becoming a global issue, so we want to talk about it today. Hi viewers, my name is Ngozi Atiti. Welcome to today's vlog. Today we're going to talk and we're going to keep it very simple. No ambiguous word here. I'm going to keep it as simple as a kindergartner, that as a 5-year-old would understand, and I'm going to keep it very simple so that even a 75-year-old will understand. So just have a basic understanding of what this coronavirus is, and this particular virus, why is it becoming a global issue, why is it becoming a global concern, and where did it start, what are we going to do, what does it look like, and what can we possibly do to protect mankind. Okay, coronavirus, I mean, it's buzzing on the internet. We all have heard about it in one way or the other. What is coronavirus? I mean, simply, it is a virus. It is from the family of the virus, you know, the family of the virus called SARS. And this was first, you know, diagnosed in China. There's a city in China called Wuhan. And it kind of started when health workers that were taking care of live animals in a market in Wuhan, where they sell live animals, you know. So the health workers that are taking care of those animals started falling sick. They started having these flu symptoms, and when they were diagnosed, they found out the cause of their sickness was called COVID-19. That is the virus that is responsible for the coronavirus. So after that, it has these similar symptoms like the flu. I mean, it affects the respiratory organ, and there will be the symptoms are seen to be that the patients at a time, they will be having difficulty in breathing, and they will be helped with some kind of breathing equipment. And later on, their important organs started shutting down, like their kidney and all that, and some of them started dying. So it became a concern, and later on, some loved ones, family members also started getting sick. So it became obvious that this virus was transferable, that is from animal to human, and then from human to human. So studies and scientists and medical professionals are really into it, trying to make sure they find out a way to stop it. The cure is not yet found, the vaccine is not yet discovered, but scientists are really working hard. Okay, so there are this virus is being found now in Nigeria, in West Africa. There's a known case in Canada, there's a known case in so many places in the world now. And how does this virus look like? Like, under the microscope, I'm going to insert a picture. It looks like a tennis ball that has some spikes. So what it does, its destination is to get to the human respiratory organ. Now, how can it get in there? The only way it gets in there is through the help of man, you and I, by transferring the virus from wherever it is in any part of our body to our respiratory organs. Like, the way this demon called coronavirus works is very, very deadly, and that's why it's a concern, and that's why we need to talk about it here. So it looks like a tennis ball with spikes, looking for, by the time it gets into the respiratory system, it attaches itself into the respiratory organ and starts causing confusion and start breaking down the system. So now we understand the way this enemy works when it gets into man. Then we try out your effort and my effort. My duty and your duty is to make sure we don't get it into our system, and we make sure we don't spread it. Okay, so what are the things we need to do to make sure we do not spread this wicked virus in our society and into our own very system called our body? Now, you see our palm, if you see the skin of the palm, it is made thicker than this other skin for a reason. God knows why he made this skin, this palm, very, very thick, because he knows that this part of the body will be used more often than any other part of the body. They find it difficult to penetrate through this palm, but they will try to find their way into the softer tissues, the softer areas of the skin, where they can, implant their spike and start doing their deadly mission. So we cannot overemphasize the washing of hands. So the first thing we need to do is wash your hands. Wash your hands when you come in contact with anything. Wash your hands when you go to the public places, when you shake somebody's hand, when you give a hug, like whatever. I mean, always wash your hands. Don't feel guilty washing your hands. There is no number of time, there is no prescribed number of time that you can wash your hands. The prescribed number of time to wash your hand is always at least for 20 seconds. And if we're talking to like a kindergarten or an elderly person who might not understand, how long 20 seconds will be, we can say, okay, sing happy birthday to you, happy birthday to you. By the time you finish singing that song, it will be well over 20 seconds. I mean, that will give you an idea how long you can have those bubbles in your hands, to make sure we break the chain of this virus and bacteria and all these enemies of man from getting into our body. So the second thing we need to do is touch your face less. Sometimes we just do this, we do this. If there's a little scratch, we try as much as possible to touch your face less, because that is closer to where this virus wants to get to. That is its destination. Its target destination is your respiratory organ. So do not try as much as possible not to get your hands to your face. And if you must, and if you might not be able to control that, then make sure you wash your hands. If you are in a public place, like in a place where you can't get, you are not like in close contact with a wash hand basin or something, or maybe a washroom for you to wash your hands, look at this sanitizer. Just a drop on your palm kills about 99.9% of virus and bacteria. You see, you just rub it in your hand, rub it everywhere, and allow it to dry completely. Like this alcohol rub, like this sanitizer, it does a lot of wonders. Ladies, if you have a space in your purse to put your lipstick, your makeup, and all those interesting and fun gadgets of females, please make sure you find a space for this. Like, it is so handy in your pocket, in your hand, in your purse. I mean, make sure you have this anytime you come in contact, maybe in a rail, in a public place, wherever. Like, just as soon as you come out, rub this quickly. And if you come close to where you can wash your hands, please do wash your hands. Okay, wash your hands as many times as you can. And if you also like going into a public place where like you'll be holding rails or things like that, also always sticking these hand gloves too into your pocket, into your handbag. Have all these tools. And if you see that, okay, maybe the washroom or something don't want to touch like public knobs or something, hey ladies, hey brothers, don't feel guilty. Just put this into your hands. Just protect your hand and touch whatever you feel like you don't want to touch with your bare hands. Maybe be it in an elevator or something where you need to press buttons and you're a bit worried that millions of people must have maybe touched their nose or sneezed and then touch it. Put this in your hand and press those buttons, and as soon as you come out, you pull them off and discard. These are disposable. Save yourself, save others, let's save our community. Again, stay away from sneezy people. Please stay away from sneezy people. Anybody you see that is always sneezing and sneezing and sneezing, please stay away. When they sneeze, please just move away. Don't allow those droplets to land on your skin. perhaps if the person is sick or if the person is infected with COVID-19 or coronavirus or whatever kind of virus that might be in the person's system, so that it doesn't transfer into you. And if you notice that maybe somehow you're suspecting that you might be sick, but you've not diagnosed yourself and you are sneezy for that day, help yourself and help those around you. Just stick in this, you know. Ta-da! So that way, when you sneeze, your own droplets is collected here. Okay? So you sneeze, your droplets are collected here. And then you get to a garbage, you just bring it out, you toss it into the garbage. There's another kind of face mask, but that face mask is meant for health professionals when they come in contact with sick people. So that one is a different kind of face mask. It's a bit more tighter than these. So that one is actually to prevent them from being vulnerable to the virus and all that. So talking about treatment, the treatment, like I said earlier, is not yet discovered, but our scientists are really working hard to make sure they figure out what they can do to help those patients. Like we have a very sizable number of patients that are sick in China, and there is a confirmed case now that is in Nigeria, but he's stable as I read, and the government is doing everything humanly possible to make sure they don't allow an outbreak of this virus in Nigeria and other countries too. He's also in Canada, and Canada is really doing a very good job to make sure it is under control so that we can still, you know, move around and interact with people nicely. So but presently what the health practitioners are doing is to be supportive in the sense that the patients, when they start exhibiting difficulty in breathing, they will assist them with breathing equipment. When they start finding it difficult to take in fluid or to drink in any kind of fluid through their alimentary canal, you know what I mean, they assist them by infusing, by passing fluid into their system through another means. So there is no curative measure per se, but there is kind of an assistive measure and a lot of care while the treatment is while the treatment search is ongoing. Like a recap: wash your hands, use a face mask if you're feeling sneezy, don't hang around sneezy people, use sanitizer. If you have to touch like very dirty things like garbage or human waste or things like that, if you want to change diaper or whatever, please use hand gloves. And if you're in a very public place and you're a bit skeptical, use hand gloves. Like, yes, use hand gloves. Don't feel guilty to protect yourself. And yeah, and when you come back, clean yourself, take your bath, just usual daily hygiene. And until I see you in another video, please stay safe and stay away from sickness. Thank you. Bye bye. And don't forget to subscribe.